back when I was just out of Temple University, having just earned my PhD, and 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 working in various institutions, and then ultimately or eventually moving into the sports realm, where I worked for the Baltimore Orioles and the Philadelphia 76ers and the Philadelphia Eagles as team psychologist slash something else. And that something else was different for each team. Um, and then on to the NFL, where I spent 10 years as vice president of player development on Paul Tagliabue's staff when he was commissioner. Um, I saw a great need, and and one of the things that my department did was try to we tried to fill that need by organizing a national network of psychologists and psychiatrists and social workers. A national network. We had literally uh, dozens of people uh, in each team city in our network of hundreds of professionals uh, able and willing to stand by and be ready to receive referrals from our office of athletes in the NFL, and as well as non-player personnel. So my job was vice president for player and employee development at the NFL. So we put a lot of energy and a lot of emphasis on mental health for employees throughout the NFL, player and non-player. So it was it it, it was it was clear, very clear, based on uh, uh, based on a lot of the negative media that we were receiving constantly on player conduct, that there is a need to do something, that there is a need to establish some kind of mental health network to help players because the NFL was just at that time when I was involved back in the early and late 1990s on into the 2000s. There was just so much negative play on Sports Center. One of the things I used to say is all you have to do is turn on uh, ESPN, and there was like a 24-hour a day loop about athletes who were having issues and who were involved in just negative things, and who were exhibiting enormous negative conduct on an ongoing basis, that it was overtaking the story of the NFL. It was becoming the 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 face of the NFL, so to speak, just seeing so many bad stories and so many negative situations that were being looped on the ESPN network. So it was an important initiative for us to undertake, and and it was not an easy initiative to undertake, because as in many areas, when you introduce mental health, you get a lot of resistance from people who are afraid of it and who don't want to face it. And there were lots of people at NFL teams, including some owners, who didn't want to face the reality of what players were going through, and didn't want to hear any discussion about having any or didn't want to have any involvement with getting help for their players. But we kept knocking on the door and knocking on, the heads, so to speak, and until there was a breakthrough, and we got consensus from from ownership and throughout the league, and that that something was needed, and that led us right into, and you might remember, we established something called the NFL Rookie Symposium, so that that effort that we put forth, um, continuing to just knock on the doors of the owners and my staff, trying to get them to understand the the you know the importance of what we were doing. It was something that had to be done. But when we finally broke through, it was something that I think the teams began to appreciate, because one of the things we saw in our analytics and the data that we collected and kept was that once we established the NFL Rookie Symposium, and once we created the mental health network throughout the country, we started to see the negative incidents, and the numbers dropped dramatically. So it was the proof in the pudding that the the mental health was definitely an issue, and trying to organize a solution to that mental health uh, was very important. And we finally got our voices heard and um, got the initiatives through. Well, I think because mental health is not limited to professional athletes, and it's certainly not limited to NFL players. Mental health is not even a national issue; it's a worldwide issue. And so we have conversations around mental health. It hardly a day goes by that I don't pick up a newspaper or listen to a news network and hear someone talking about mental health and the need for mental health, and how mental health is an issue in this area, how it's an issue in that area, and what people and professionals are doing in the mental health domain to try and and help in some of these areas. Uh, for example, every time we hear about a shooting, a mass shooting, for example, what are they blaming on? They blame it on mental health, and from every incident, every time there's an incident, it's followed by hours and hours and day long and week long discussions about mental health. So I think we were ahead of the times, no question about it. But I think now that it's exposed, it's not something that's a label on the quote unquote NFL. Mental health is not something that's a label for professional athletes. Mental health is a problem we've discovered throughout society.